This one is indicating of another challenge that somehow is maybe temporary. We're forgetting the antimicrobial resistance that is developing worldwide. We have Dr. Kerry Nigito from the veterinary school. So it's good to have our veterinary colleagues participate in this conference. One Health, we bring all professionals together. His presentation is on the prevalence of antimicrobial residues in carcass tissues of ruminants in Grenada, the West Indies, a cross-sectional survey. Just a little bit background on Dr. Nagito. He is a clinical tutor in the School of Veterinary Medicine, Department of Large Animal Medicine and Surgery. Sorry, I'm saying he, it's her. Her interests include, please forgive me, food, animal production medicine, food safety, and public health. Her research focus is production medicine in developing countries and food safety, in particular antibiotic and antimicrobial residues in food products. Dr. Nagito earned her Bachelor of Science from Allegheny College before obtaining her Doctor of Veterinary Medicine from St. George's University in 2009. She is currently pursuing a Master of Public Health at SGU. Good place to pursue, by the way, your MPH if you want to get one. In addition, she is a long-standing member of the American Veterinary Medical Association. So again, my apologies, please, Dr. Nagito. We look forward to your presentation.
Thank you, Dr. Ford, for that nice introduction. I'm just going to share my screen here. Can everybody see it? It's okay. Can you hear me? Okay, great. All right, so good morning and thank you for attending this portion of today's program. I will be presenting a small portion of preliminary data that my colleagues and I have collected as part of a larger and ongoing project that we are conducting here in Grenada to investigate the prevalence of antimicrobial residues in carcass tissues. The development of antimicrobial resistance continues to be a significant global public health burden. The major contribution to the development of resistance occurs mainly through the use of antimicrobials in the human population. However, antibiotic use in animal populations has also been identified as contributing to the development of resistant pathogens and is the main focus of this project. I think it's important to understand where we are currently in the fight against antimicrobial resistance and why addressing it continues to be a global priority, especially now during the pandemic when some of these other public health issues are maybe on the back burner. And according to a recent report by the Centers for Disease Control on antimicrobial resistant threats, it was reported that more than 2.8 antimicrobial resistant infections occur in the United States each year. And of those, more than 35,000 result in deaths. And I think that these type of statistics continue to be concerning, especially because these only really account for the population in the US and not the rest of the world. So as a result, there are many global public health initiatives to address antimicrobial resistance. Agencies like the World Health Organization, the Food and Agriculture Organization of the United Nations, and the World Organization of Animal Health have collaborated to develop recommendations and guidelines to assist countries with addressing the development of antimicrobial resistant pathogens in their populations. More specifically, the World Health Organization developed a global action plan in 2015 to address antimicrobial resistance and increase awareness. The World Organization of Animal Health has included guidelines in the Terrestrial Animal Health Code to address antimicrobial use, surveillance, and monitoring. Many developed countries, like the United States, have instituted strict regulations to limit the use of antimicrobials in food-producing animals as one method to combat resistance. And a great example of this was when the Food and Drug Administration issued a veterinary feed directive final rule in 2015 banning the use of antimicrobials in feeds for the purpose of growth promotion. And this mandated that all medicated feeds must be prescribed by an overseeing veterinarian for the sole purpose of disease control. Additionally, extensive antimicrobial surveillance programs led by the Food Safety Inspection Service under the United States Department of Agriculture have been implemented to screen food products for antimicrobial residues. In developing countries like Grenada, screening programs and regulatory legislation are more difficult to implement because of the lack of resources that are available. There are currently no surveillance programs of local food products for antimicrobial residues, so information about their prevalence is unknown. And this presents a potential risk to local populations who are consuming these products. Research has already been conducted in Grenada that have identified the presence of resistant pathogens, and surveys have been conducted in the Grenadian poultry producer population to assess their knowledge of antimicrobial use. So basically, we were just missing information about the presence of antimicrobial residues in the food producing animal population. And it's difficult to develop intervention programs to address antimicrobial resistance without really understanding the scope of the issue. So the goal of this cross-sectional survey was to establish some baseline prevalence rates of antimicrobial residues in cattle, sheep, and goat carcasses processed for local distribution. In order to do this, we collected muscle, kidney, and liver tissues from carcasses slaughtered at Grenada's central processing facility in Mirabeau. The collected tissues were then screened using PREMI test kits, which are microbial inhibition assays. A color change from purple to yellow after incubation of the agar ampules indicated the absence of antimicrobial residues. This assay was used because it's known to be sensitive to a large range of antibiotic classes and is a quick, easy, and cost-effective screening tool. Samples that remained purple after the negative control changed color to yellow were recorded as positive. And you can see here some photos of the ampules containing the agar before inoculation, as well as the color change of the negative and positive controls, and then what a typical batch of the samples that were run with controls would look like. So tissues from a total of 90 cattle, 72 sheep, and 91 goats were screened using this technique. In this population, 8.3% of the total tissues tested positive. The highest proportion of these positive tissues corresponded to cattle species at 4.9%, followed by sheep at 2.1%, and goat at 1.3% of tissue samples. So because muscle tissue contributed to the highest proportion of positive tissues at 7.1%, we looked a little bit more closely at the distribution of the positive muscle tissues across these species. And we observed about a 34% prevalence in cattle compared to 21% in sheep and 9% in goats. So just to kind of put some of these numbers into perspective, in the 2019 Red Book data record of residues in the US, 1% of tested beef cattle carcasses were positive for residues compared to 2.4 in sheep and less than 1% in goats. I'd also like to note that without doing additional quantitative analysis, we can't determine which antimicrobials may be present in these samples or their concentrations. So we cannot determine if any of these residues exceed maximum residue limits at this time. So some of the implications of this data is that we did identify a potential risk of consuming food products contaminated with antimicrobial residues by local populations. And this is especially relevant right now during the current COVID-19 pandemic circumstances, where there have been interruptions and restrictions on imported meat products. And this is going to increase the demand and consumption of local products. Lower income populations may also be at increased risk because imported meat products are likely to be more expensive. And again, there may be less availability due to like production interruptions as well. And this would also drive the cost of these products up. And lastly, the presence of residues in food-producing animals continues to contribute to the development of antimicrobial resistant pathogens, such as E. coli and Campylobacter, which has already been identified by some of my colleagues in the School of Veterinary Medicine. So what can we do to address some of these issues with respect to antimicrobial resistance and residues? Well, a recent qualitative study surveying poultry producers by my colleagues in the public health department identified a lack of knowledge of these producers on antimicrobial use. And the Ministry of Agriculture have already begun educational programs for producers to increase antimicrobial use awareness. Unfortunately, these sessions were interrupted because of the current COVID-19 pandemic. And lastly, implementing stricter regulations of over-the-counter products and imports containing antimicrobial ingredients may also be warranted. In conclusion, using this survey as a baseline examination of Grenada's food production antimicrobial stewardship program provides a good place to start for public health practitioners and veterinarians like myself, in collaboration with the Grenadian Ministries of Health and Agriculture, to implement educational programs and monitoring systems to address antimicrobial use and regulation. Thank you. I'd just like to take a moment to acknowledge some of my colleagues who helped with some of the lab work that I did, which was a little bit tricky over a pandemic situation. So I just want to acknowledge them here.
Thank you so much,
Thanks.
Dr. Nagito. Oh, yeah, sorry. You were going through your references there?
Oh yeah, there's some references that I used. So, and Dr. Ford, you'll see your name here.
Yeah, guilty as charged. Thank you so much for, again, yes, COVID-19 is the pandemic flavor of the day, the year, but that doesn't mean the other issues, and you've tackled one that the WHO has put in as in their top 5 public health crises that we need to. So thanks for reminding us that we need to keep focused on the use of antibiotics in particular, in this case for food production, the dangers and the need to regulate it. Please, there are questions that you can place. We have a question in the chat. One question coming from Dr. Badesi. Can there be a replacement for antimicrobial use and animal production to reduce the exposure to residues, he asked?
I don't understand a replacement. I think,
In other words, for example,
like
in the States,
alternative.
they use, I think the management of using antibiotics or antimicrobials is, especially in Europe, is becoming more and more managed. Weaning farmers off the use of antibiotics and antimicrobials in general, is that feasible, for example?
Yeah, so again, in food production, a lot of feeds and producers use antibiotics in a more preventative way. And so again, this goes to the topic of judicious use, and really antibiotics should only be used to treat disease, and only in diseases that are going to be susceptible to antibiotics. And so it's kind of the same in like human medicine, is that we're not going to give antibiotics for a viral infection, that is not going to be effective. And so I think as veterinarians that, again, overseeing the distribution of antibiotics and the prescribing of antibiotics, and, recognizing, like, there are studies that are done that in countries where they have removed medicated feeds, and those animals are still productive and still produce the same amount of meat. And so there are studies from countries that have again, eliminated the use of medicated feeds, and those animals are still healthy and they're still producing high quality, safe food, for consumers.
Yeah, a couple of questions are coming in asking about the classes of antimicrobials that are being used. Were you able to discern what antibiotic classes are being used for cattle, and what are the indications for their use? I mean, is it prophylactically, or is it there actually an outbreak of some infection that the vet prescribes a particular class of antibiotic? Do you have any information on that?
The only information I have, because again, I don't, until we do more quantitative analysis, we don't know which antibiotics are actually, in these tissues. But as far as with the over-the-counter availability, there's macrolide classes, beta-lactam classes, and sulfonamide classes that are available just from just going to farm stores and seeing what's available over the counter.
Okay. And besides Grenada, I mean, you focused on Grenada in your, are there other islands in the Caribbean region where we have data on antimicrobial resistance in ruminants?
I mean, I didn't focus on resistance itself, but other countries like Trinidad have done surveys of milk products and poultry. So again, poultry is another large consumer product, and so there have been some studies looking at the prevalence of residues in those products. Again, that's not something that I focus on here. But as far as like resistant pathogens, again, I didn't really look at, because the focus was in Grenada, but resistant pathogens have been shown, I think, pretty like globally.